It is now 11 o'clock, so we will get started. Thank you all for joining the Georgia Department of Public Health Strike and Support Team Office Hours Kickoff Meeting. I am Maya Labat, your host for today's event. Please keep in mind that this event will be recorded, and if you have any technical issues, please drop them in the chat.
Thank you, Maya. Let's go ahead and get started. It's wonderful to be together today. And this is our first, our inauguration of this work. We're very excited to be partnering with others in this. So let's get started and go on to the next slide, if you will. I want you to meet the team that's here, and our faces are on the screen for now, but I want you to know that we're excited about supporting you, and we'll be growing this team, I'm sure, in the months to come. But for right now, my name is Linda Kluge. I'm the Executive Director at Alliant Health Solutions, working with our contracts that have to do with quality. And we've got several of them, but this is a really important one to us that we're getting to work together with you for improvements in infection prevention. Melody Brown is on the call. Melody, do you want to introduce Amy? And let me just say, Melody is one of those folks that has been with us for years, working in hospital work as well as nursing home work, working on our efforts with our Beneficiary and Family Advisory Council as well that guides our work. But she is well known to folks in Georgia.
Thank you, Linda. And yes, thank you everyone for joining us today. And it is my pleasure to introduce our two infection preventionists on our team, Amy Ward and Donald Chatanda. And they'll be joining us today with roles as well as in the future for future trainings. And in addition, Linda, I guess I'll turn it back over to you to introduce Dr. Garr.
Well, thank you. Thank you, Dr. Garr. It is a pleasure to have you joining us as our medical director for this work and for really guiding the Georgia DPH team as we think through how can we really support medical directors that are in the SNF facilities, as well as guide us in the really best practices that we need to have for infection control. And we're going to be able to hear from you today with a targeted presentation, which will be great. And we'll plan for these, let me just say, on a monthly basis. If you'll go on to the next slide, I'll share a little bit about the plan. Georgia Department of Public Health came to us in the fall after the contract award from CDC came to the state of Georgia. And many of you who have peers in other states, you may be aware that the strike fund work was really tremendously, resourced by the American Rescue Plan Act. And as that funding came through, the Nursing Home and Long-Term Care Facility Strike Team and Infrastructure Project was born to support nursing homes as well as long-term care facilities. So those facilities that are independent living facilities, assisted living facilities, personal care homes with over 25 beds, those facilities and locations around the state of Georgia are also welcome to this work because those sites were hit just as hard with the issues with the coronavirus in the past 2 years. So we want to make sure that we're reaching them as well and learning more about what their needs are. But for right now, we're really focusing on how we can support you well. And office hours is one way to do that. It's just like when you think about a doctor having office hours. They're available. They're there to talk to you. They're there to answer your questions. So we will have 2 of these office hours every month. One of them will be focused on the staff and the infection prevention work, and one of them will be focused on the needs of the skilled nursing facility medical directors. We really want to support them well. This funding from the Georgia Department of Public Health is going to really afford a lot of good training and education in the future. We're looking forward to providing as soon as May some infection control training, maybe really for infrastructure, or some people will say the boot camp kind of idea. What do we need to know to just get started on a good foundation for infection prevention? And so we'll be working with that type of education twice a year, May and October. And we're looking forward to providing that, as well as training for respiratory care processes, so that we're making sure there's a firm foundation for understanding in that area. So we're looking forward to the training as well as the monthly calls that we have. You'll also learn more in the coming weeks about the support that's going to come from the University of Georgia. And let me tell you, that's a motivated team over there that is going to be supporting skilled nursing facilities, the personal care homes, independent living around the state. There is great work to be done on their behalf in the areas of workforce resiliency, making sure we have the staff that we need and making sure that they're well prepared. So we're really looking forward to that work that's going to come your way as well. We're also pleased to say, I think on these calls, we'll have some core people from the Georgia Department of Public Health joining us. Teresa Fox, Regina Howard, Raven Speltz will be with us, and we'll look forward to them sharing on future calls as well, and cheering you on as you learn more together in this office hour environment that we're creating together. Next slide. So as we flesh out the reasons why we're gathered together, we really want to make sure we're meeting your needs too. We want to give updates, make sure that people are learning about what's the latest. We want you to have a safe place to be able to vent as well, because that's one of the things when you have an office hours, people can come in and just say, this is extremely difficult. I would love to be able to get this done. I need to learn from others on this. So we want you to be able to come and share openly. The chat box is a great place to do that, and then we can open mics depending on the number of callers and be able to share that way as well. But we want to provide you updates, latest ideas. Every single week there's something new, it seems, in the NHSN world. And so if you've got questions about that, we're open to sharing on that as well. But it's your chance to really get your needs met. Maybe some sort of a list that you'll keep during the month, and then you can send in questions to us in advance, or you can save them for our monthly call. So we want you to come prepared and know that we'll be here to support you as you learn from each other and as you learn from our subject matter experts that are going to be on the line. Next slide. So we have not set the dates yet for the May training, and we're looking around dates that are going to be ones that we want to miss. We know that skilled nursing facilities have a big week coming up after Mother's Day, and you're going to be very busy that week with lots of extra activities. That may not be a good week for us to get with you. And we also know that Memorial Day is right around the corner. So we'll be finding the right time to really take a deep dive around infection control with you, and we'll keep you posted on those dates as we develop them and work around as much as we can those national and state events that are going on. We want to make this easy for you to attend. Everything will be recorded and posted on our website, and we'll make sure that it's available to you for 24/7. If you can't attend, you can send staff or send yourself to catch up and take a look at things that are recorded in advance so that you have that just-in-time learning that you need. Your opinion matters. And Mel, this is a great question that you like to ask people all the time. Do you want to jump in here?
Yes. So actually, Linda is giving me a little more credit than she should this morning. This is one of her favorite things that she asks us a lot of times and has for many years at staff meetings in different places. What is keeping you up at night related to infection prevention and what you're doing right now? We know that everyone has had a very rough over 2 years, and now as you're beginning to get things back to whatever the new normal is going to be, please enter into chat either right now or during the call today, things that are keeping you up at night, because we really want to design the trainings that Linda was talking about, as well as the monthly office hours. we really want to design those around things that you need and that is giving you problems or that you would just like to know more about. So really, if you will fill up the chat, we will be more than happy to embed those into future offerings next month, whether it be the office hours, the trainings, and going monthly from there on. You know, as Linda said, keep a list and be, you know, feel free to send that list to us throughout the month. It doesn't just have to be on these calls because we want to be here to serve you in the best way that we can. Thank you, Linda.
Sure, sure.
So we just wanted to make a quick announcement. CBIC, or the Certification Board for Infection Prevention and Epidemiology, has announced a new certification that's specific for long-term care. So applications will begin in July with testing periods opening in September. So if you would like to receive updates, go ahead and use the link in chat and sign up for updates. But just an exciting new certification offering from CBIC. And with that, I will turn it over to Dr. Gar, who will give us some important COVID-19 updates.
Thank you, Amy. So, you know, one of the things that I would say is I was doing a talk for some other state, and it was pretty quiet. And I'm like, in Georgia, we are not like that. We talk to each other and troubleshoot problems together. So I do want to see in that chat, you know, what is really, what are the issues that y'all are facing? Yes. Linda says we share shamelessly. Yes, we do. And we're proud of it in Georgia. So I do want us to talk about the things that you guys are seeing out in your facilities that are challenging for you, or that is a great breakthrough for you. Any problems that y'all have been able to figure out somehow. I mean, you know, we have been now 2.5 years into this. And we hope that we have learned some from that. So that is important. The other thing is I mean, I see that several of you, we have met before. I love speaking to our group, and anytime you have any questions, whether they are clinically related or they are non-clinically related, you know, absolutely throw it at us, and we will, if we don't have answers, we will figure out the answers and we will get back to you. So this is just, I mean, I would love for us to use this as a forum where we are troubleshooting our difficult situations, etc. That being said, I will, you know, talk about what I hope to present here over the next, whenever I present, is what is coming up down the pipeline. You know, we know that this virus is fast evolving. We know that the regulations are changing. I mean, did we ever think that CMS is going to move that fast? But it is moving fast, and sometimes it's hard to keep up. So I hope to bring in, you know, the issues that the new regulations that CMS has come out with, and what do they mean for our facilities, and also what is CDC coming up with, because it seems like information is changing super fast. And thank God for that, right? Because the virus is changing super fast. So, you know, as a medical director, I am always kind of keeping up with, okay, what are the new studies that have come out? What is the virus doing? What is CDC, how is CDC responding to that? And how is CMS responding to that as well? So those are the informations that, as a medical director, I hope that all medical directors in the facility are kind of keeping up with that, but it can get incredibly hard. So I'm going to try to present it in bite-sized pieces, hopefully, and continue to present that evolving information so that we are not, you know, we're not kind of blindsided by something new that was out there and we didn't know. That being said, what Amy said is important, that, I can tell you that I do engage with CMS at different levels, and it is incredibly important for them. Two things I think that we have seen are going to be super important. One is, as the president in his State of the Union talked about nursing homes, which was, I'm happy with that, because, finally, I feel like nursing homes are on the radar of people. We have been talking about the nursing homes and the challenges that we face in the nursing homes. So I'm happy that there is attention being paid to the nursing home. How it is all going to flush out is really a matter of, the whole gravy and or the sauce saying. But one of the things that I do know is going to be on everybody's radar sooner or later is emergency preparedness. And I want today's talk to kind of have that emergency preparedness hat as well. So I'm talking about COVID, but the principles are of emergency preparedness. The second thing is what Amy said. CMS is really focused on making sure that there is a infection preventionist function in every building. How that is going to flush out, I'll let our infection preventionists speak to that. But those are the two topics that are big on CMS's mind. So with that being said, let's talk about, how we kind of take that principles of emergency preparedness and kind of put it on what is going on right now, COVID. So how to be ready for the next phase or next thing that COVID is going to throw at us in different facilities. So I wanted to share with you some of the things that in every facility somebody should be assigned. It's for us, it is me and it is my administrator who, kind of at the beginning of the week, we look at all this data. So I'm sharing the websites and the data that we look at to make sure that we are prepared for the week and we are not going to get blindsided by a new virus. So be on the lookout. And next slide, please. This is a website that, this is a graph that you should be very aware of. This is a website you should be very aware of. This is the CDC Data Tracker. And in that data tracker site, if you look at it, there are several little boxes. This is the one with the variant. And this is extremely important because I can tell you the last time I talked, maybe last week, the variant was kind of around, 60%. The BA2 variant was what we were worried about. And now it is representing 74.75%, right? But I do want you to focus on what is going on down here, where there's that reddish, not the light pink, but the dark pink area. This is of concern. So what we are seeing is, and I'm also talking to folks from the Northeast, they are seeing many patients get sick and outbreaks happening in the nursing home. And typically in the South and the Southeast, we are probably 3 to 4 weeks behind. It also depends on how much traffic there is back and forth. And with the spring coming in and people traveling more, I am a little concerned that that duration is going to be shortened. But what with the BA2 variant, as much as we were concerned about it, what we had seen is, and especially in the Northeast, what we saw is that disconnect between disease activity in the community. So high disease activity, but continued low levels of hospitalization. And that makes us take a deep breath and say, okay, calm down, chill out. We still may be holding on and it's good. I do want to tell you though, this BA 2.1, 2.1, this dark pink one that is coming up in the bottom, it's what we are starting to see, and what I'm hearing from the Northeast is there is that uptick in the hospitalization, and that is of huge concern. So have somebody in your facility go and look at this and see what is happening and what is happening in your community, because as you can see, the HHS regions in the top left hand are, right now it's the whole of United States. And if you look at the Northeast and the Southeast, there is a little bit of a lag. And that, is, I think we are fortunate that we kind of get it later, but keep an eye on what may be happening in your community. Next slide, please. Okay, I know that we, from the CDC Data Tracker, what we were doing before, and I should have included that slide, is, how they tell you the county levels of disease activity and positivity rates on which we have been going, right? We have been kind of keeping that as our Bible to what are we supposed to do? Are we supposed to do face shields? Are we supposed to do N95s? Are we supposed to do testing for unvaccinated employees? What are we supposed to do, right? That is, while that is important, and I think we all should be looking at that, because it also tells us the hospitalization, and the hospitalization piece of it is super important. I do want to tell you a caveat that now we have started seeing with all the home tests that have been made available. It's a wonderful thing because it kind of takes care of that access issues. I have a home test at home, and I cannot tell you how, well, I have several at home, but I cannot tell you how many times we have taken those tests just because I have a sniffle, or I mean, it's, my car is all yellow. We are all experiencing that pollen, but we constantly do home tests. The problem with that home test though is if I do test positive, I'm not reporting to anybody. I'm self-isolating at home and hoping that this will go away. But this whole contact tracing and all the tests. So the bottom line is, what I'm saying to you is, those tests that are showing up on DPH, or were showing up on DPH website when it all started, and are not now showing on CDC website, are not really a true reflection of what might be going on in your community. So don't take it, but take it with a grain of salt. Hospitalization, the top is the test and the second is the hospitalization. Hospitalization data is still very, very, very important. So make sure that you follow that. What I have started doing is I have started looking at this wastewater surveillance, and that is also one of the little tabs on the CDC Data Tracker, because wastewater is collecting the virus, virus load in the wastewater of the community. So while we may not be able to catch all the tests, what is happening in the wastewater is kind of pretty simple. Like if it is in the community, it is coming in the wastewater. And here is where I am a little concerned. If you look at this map and you look at the oranges and the reds and the yellows, that tells you uptick, 15-day uptick in the activity. And if you look at it, you are seeing a pretty significant uptick in the activity in the wastewater of increase in viral counts. 100% to 1000% and more is the highest group of what is going on in the Southeast. So that is where I would start getting a bit concerned and start watching this area, because this is what is going to give me the disease activity in my neck of the woods. So make sure that you do that. It has a few ways of looking at it, and what we are going to do from Alliant is actually we are we are making these little bite-sized learning where I will go over all of the websites, how to get to that website, what to look for, and how to get prepared, your nursing home prepared for this disease activity. All right, next slide, please. All right, so how do you make sure that you feel like you're ready, right? One is up-to-date vaccinations. I cannot stress this enough. I cannot stress the importance of this enough. You know, as a medical director, I never thought in my entire life, I mean, I love geriatrics, I love long-term care. I have practiced in long-term care for almost 25 years. This is all hair dye. But it's, I never thought that I would go through what I went through in the December of 2 years back. We had so many patients who were COVID positive in our facility that we had to actually we had the whole COVID unit, which was about 32 beds. And then we had to extend that COVID unit into our other units as well. And I cannot forget the patient loss. I cannot forget the worry. I cannot forget the daytime, nighttime rounding. I cannot forget the staff shortages that we had and how we made do. I had 42 patients Christmas of that year who were COVID positive. And the vaccines were coming out then. And I tell you, I have never fought in my entire life for something, you know, more vehemently than I did for the vaccines for my patients. And the last Tuesday, Wednesday of the year, we had our major vaccine, you know, the big vaccine push. We gave vaccines to everyone who were willing to take. We were like 95%. We gave that first shot, and I can tell you, 10th of January, we had zero cases in our building. And we have been so vaccine forward in our facility because we saw what happened with the vaccines. We have had zero cases of Delta that we have given to our patients in our nursing home. We have had probably 8 patients total between the 2 buildings of Omicron, and none of those patients had literally any symptoms because we were so up on the boosters. And last week, we gave our second booster campaign. So I cannot stress enough as to what an incredible difference it made in our patient's life. And, you know, nothing succeeds like success. The fact that our staff looks at our patients and sees the lack of, you know, it's raging. Delta was raging in our community, and our patients were so well protected because our patients were vaccinated. They had their boosters if there was time for their boosters. Our staff was very highly vaccinated, and they created that wall of protection around our patients. And I mean, they see the benefit. And staff came to me and said, "Oh, Dr. Garb, when are we getting the boosters?" And I'm telling you, literally the day that ACIP met for that boosters for healthcare providers, because everybody's ear was, are we going to get it? Are we going to get it? There was a line at 4 o'clock because I think around 4 o'clock is when the CDC director said that healthcare providers can get a booster. And there was a line of CNAs and nurses who were lined up there like, open a vial, we want it. And so we are very vaccine forward, and we have been seeing the results of that. And I can't tell you how incredibly amazing it is to all that for all that to happen in the community, and for our patients to be completely cocooned and protected just because of that reason. So this is a lull that we are seeing. Take advantage of it. That's what I would say. PPE and infection control is the other important thing. So for our staff who is not up-to-date vaccinated, we are recommending that highest level of protection, which is an N95 mask and eye protection, because that's what OSHA also asks us to do, is to provide our staff with protection in our buildings. So they are continuing to wear that. We are making sure that we are doing our PPE logistics. We need to have enough people in gowns, if that the need be. So don't, I would say that don't stop, just making this just a constant hardwired thing in your facility. How many gloves do you have? How many gowns do you have, etc. And then testing, of course, we need to have testing kits in place, and but making sure that you're continuing to do that surveillance, because it's going to sneak in, it's going to creep in, making sure that we are continuing to do that surveillance and doing testing. And I can tell you the way that we do it is every single morning in our clinical meeting, we talk about COVID surveillance, and we have been doing it for 2.5 years. It takes literally 1 minute for one building, 1 minute for the other building. Essentially, we go over anybody who was positive in the hallways, who was positive for any of the COVID related symptoms, who got tested, what was the results of the test, and that's it. New admissions, can we go to the next slide? Okay. Oh yeah, this is an important slide, but going back to the previous slide, I just wanted to say, from vaccine standpoint, what we have seen, and I'll just insert this here, yeah, that up-to-date vaccination is such a key factor. One thing that people don't know or don't pay enough attention to is how much of up-to-date vaccination does it help our operations in the nursing homes, and I will tell you how. When you are, CDC says that fully vaccinated status happens 14 days after that second shot of that primary series. However, up-to-date vaccination status is achieved the next day after you get the vaccine, right? Here is what we have seen. When people come to us and they are not up-to-date vaccinated, you have to isolate these people, new admissions, according to CDC guidance. And you can only have one person in a single room. And you can't bring them into the, into the general population. So that is the logistics of it, right? But if you either talk to the hospital and say, can you please vaccinate this person before you send them? Because the hospital who's looking for throughput, we are always under throughput pressure. We are very closely, we are a big outflow facility for the hospital. They're constantly wanting to send us patients, which is yay, great, right? Because it helps our census. You know what helps your census is if you give them the vaccine either right from the hospital, because then you can bring them right into your regular units, or you bring them in, give them the vaccine, and get them into the regular units. And now you're having 2 patients in a bed where you would block that bed for, for 7 to 14 days. So that is how it affects our operations. It affects our operations with staff as well, exposure, quarantine, etc. Depends on if your staff is up-to-date vaccinated or not. So keep that in mind. That is a very, very important consideration. Plus our PPE use is like very low because we're so vaccine forward. We just give them the up-to-date vaccination. We're not having to wear PPE every 2 seconds. Next slide, please. It is also very important because of this, and I'm going to go through this. This is a somewhat of a complicated slide. It looks complicated, but it's a simple slide. This is a study in NEJM that was recently published, and what you can see is these are the neutralizing antibody titers. So the black dots are the ones that are neutralizing titers against Delta variant. The red ones are the BA.1 variant, which is the initial Omicron. The BA.2 variant is the blue one. And I want you to look at that first set on the left. This is when the prime series, right? The prime series is your series of 2 shots. Look at how close to 0 the response against Omicron is. So if your staff is saying, hey, I got my primary series and I should be protected, the answer to that is no. You didn't get protected even with the primary series. Look at how close to 0 it is and how high the activity against Delta is. And that's why you were protected against the Delta with the primary series, even if you didn't get the booster. And then the second block is right before the booster. So these are people who are eligible for a booster, but have not gotten a booster yet. And you have still pretty good activity against Delta, but look at where they are against Omicron and BA.2. Nothing. You have nothing, no protection, 0 protection from antibody titers. But look what happens after they get the booster. They have pretty darn good activity against the Omicron. Your activity against Delta went up, but look at what happened with the Omicron. You are now protected against the Omicron. So does that play out in real life? Next slide, please. Here is the data out of UK, because UK had a pretty significant Omicron outbreak, and what its effectiveness against symptomatic disease. So the blocks are Delta, and the circles are Omicron. And you can see that after the dose 2, your activity against Delta is pretty good, and Omicron is also fairly good. And the activity against Delta goes down as you get far enough away from that second dose. But look what happens to the activity in Omicron. It really dips. And then you get, so the middle block is the one when you got a Pfizer booster, and the last block is the one where you got the Moderna booster. And it doesn't matter which booster you got, but do you see that the activity against symptomatic disease significantly increases? Your immunity against symptomatic disease significantly increases after getting the booster. So that is where the real life experience is playing out. Next slide, please. And the effectiveness against hospitalization is similar, where you are, again, seeing that significantly high activity with Delta after the second dose, and pretty significant effectiveness against hospitalization after the, immediately after the first dose, after the second dose, but see how it starts sliding down. And then whether you got the Pfizer booster or the Moderna booster, your protection against hospitalization is pretty high. And these are actual numbers of actual people in the UK, and they have been reporting it out. So this is the reason why when your staff is saying, hey, I got my first one, my first series, and I don't need it, this is what you need to kind of show them when they are telling you that we know, in ID circles and infectious disease circles, there is almost no activity, no protective activity in your immune system if you didn't get the booster and you were eligible for one. So I just wanted to bring you that. And with that, I think that is my last slide, Melody.
Dr. Garr, thank you so much for all of the information that you have shared this morning. So we hope that that has been beneficial for everyone. At this time, a couple of things are going to happen. In just a minute or so, we're going to have some polling questions to pop up on your screen. We really would appreciate if you will answer those polling questions this morning for us, plus give us your opinion, because as we said in the very beginning, your opinion does matter. So in addition to that, Donald and Amy, we're going to ask, do we have any questions in the chat or the Q&A box? And while y'all are queuing those up, Amy, if you will, and you just did, drop the presentation link in for the slides. All of the information that we will be sharing on our office hours, as well as the training, will be posted to this link out on our website. In addition to that, after we're done with today, it'll take about 24 hours, but we will also post the recording from today. So again, if you will answer the polling questions, and Donald, do we have any questions right now in the chat or the Q&A box?
Yes, Mel. Just looking here, it looks like we have a couple questions. So first question, what does an infection prevention look like in a long-term care facility? What does that really look like today?
All right. Well, Donald, thank you for that question. And that's a very good question. We are getting a lot of folks that are new to their infection prevention role. And but we get a lot of questions around how do we really get started? So Donald and Amy, I'm going to punt that back to you to give us your thoughts on that and how we're assisting folks right now. So Donald, you want to start out?
Sure, I can start out. So yeah, I think, as Dr. Gar mentioned, right now we're seeing the lows and, really take advantage of it. So, what we would say is just, getting back to the basics. Infection prevention, it never takes a break, it's just, it's different waves of infections and, the outbreaks, the pandemic, but just basic infection prevention never takes a break. So, what does that look like? Obviously we always start with hand hygiene when we talk about infection prevention. So making sure, you have a very solid hand hygiene program. What that looks like, making sure you have, good observations, dated observations. That way you capture good numerators and denominators that'll help you track and trend to see where your improvement opportunities may be for your hand hygiene program. Other things, just trying to make sure you're embedding infection prevention into your QAPI plan. That's also very important. Obviously PPE, personal protective equipment. That's always something, we talk about when to use it, what's appropriate. Making sure you're practicing according to what your policy states is also very important. Make sure you're up to date on that. And just speaking of policies, this is a good time to make sure your policies are up to date. We've had a pretty rough and long 2 years, so you want to make sure that what you're doing and practicing is up to date and according to policy. Tracking and trending infections and surveillance activities is always, very important. You want to have a good grasp of what's going on in your facility. So if you're experiencing an outbreak, you want to have a good grasp on that, and just that's something you would get through just regular surveillance. Just, a couple other things, cleaning, disinfection, obviously is always very important. Dietary, you want to make sure, you're also keeping up with all of that. So that's most of what I can think of as far as the basics. Amy?
Yeah, so I just would add on to that, that we're looking forward to some of these upcoming trainings that we'll be offering, where Donald and I will help you develop an infection prevention plan, and look at those things. So stay tuned for the registration for those events, so that we can get a really good infection prevention plan and build those basic practices in your facility.
Well, thanks, Donald and Amy. So do we have any other questions or thoughts in the chat right now?
I would
Yeah.
also,
Go ahead.
sorry, I would also want to chime in. As a medical director, I can tell you that, our infection preventionist does a great job in kind of steering, but there are so many questions that we have. And we typically, she would come to me and ask, and sometimes I am like, huh, and then we reach out to you guys, actually. So use that resource of reaching out to, Alliant or to DPH, and make use of the infection preventionist panel that we have. You guys have been so useful for us. And the second thing that Donald said, I would underline that is, I hope that your policy changed throughout this, because you gotta update your policy, because when it all started, we had so much of stuff that we had to put in our policy, and now that the vaccines are out and we have good rates of vaccination, our policy has been changing, and sometimes we kind of go back and say, oh my goodness, I can't believe we wrote all that in the protocol and we have not amended it, because you are going to be surveyed against the protocol that you have. So your protocol needs to be updated. So I just wanted to put that in there as well.
Yeah, and I'll also add that a lot of times we're in a situation where we might not know what questions to ask, right? If we're new to IP, or we're just building a new IP program, or even updating our IP program, we may not know the right questions to ask, or we may not know what we don't know, right? So I think this will be a really great opportunity for us all to learn from one another and build those practices and programs with one another.
By all means, we do need to share, and share shamelessly, as we have said many times with Alliant throughout time. Linda has added in here that this is our opportunity to share policies, guidance, best practices. So, as time goes on, as the months go on, by all means, if you have a best practice that you think is really working, please let us know about it, because everybody out there, we're all struggling to get back to our normals and everything. So we need to share with each other, and we're a great state in the state of Georgia to be doing this sharing. And so, well, we are moving down on time. So Donald, any other questions in the Q&A or chat box?
Yes, looks like there's one more. This one's for Dr. Gar. So as someone that's not as familiar with the wastewater surveillance program, could you just clarify or just go in a little more detail about what that program is? Is that something that's being tracked here in Georgia?
And Dr. Gar, you're on mute.
You can't have a meeting without having to tell somebody that they're muted, right? So I thought that, I am such a nerd. I loved the fact when CDC came in, they were looking for, somebody or some of the nursing homes to kind of you put a sensor in literally their sewer. And what they have done is they have done that all across the country. And what happens is, if I have COVID, the sewer is going to have COVID. So what they have done is they have pooled this wastewater data. They have put sensors in, these wastewater areas in the sewer, and they look at the load of COVID virus in that. And based on that, they will tell you what the sewer activity of, COVID virus is, how much is the load, what is going on there. And the interesting thing is, it is the #1 indicator of what is going to happen in your community. So how we had like Omicron and Omicron and Omicron, and we were just all getting so worried about it, like it's not going away. The first thing that I saw, on NPR was that the wastewater surveillance of Boston area, for example, had started showing that decrease in activity or viral load. And I'm like, oh, thank you, God, it's going to go away. So that's the first indicator that goes up. That's also the first indicator that comes down. So that's a pretty amazing, thing to do. I had no idea, but they have been doing it. It's pretty cool.
Thank you, Dr.
Thank you.
Gar. We appreciate that. And again, today we hope that there have been a couple of things, or maybe more than a couple of things, that have been brought to your attention that you were not aware of, such as the wastewater. We hope that you heard it first, hot off the press from CBIC. I'm not sure where that's going to go yet, but these are the things that we want to bring to you every month. And Dr. Gar, I see you had your hand up there a second. Something.
Yeah, I saw another question. There was a clarification needed. An unvaccinated resident that receives one shot in the hospital prior to admission can be admitted to, no, so if your resident is unvaccinated and they receive the first shot in the hospital, they are still going to come into your admission unit in isolation for 14 days. And then you are going to give them the second shot. After 14 days, they can come out and they are going to be protected with all that masking and everything. And then you give them the second shot. They are fully vaccinated after 14 days after the second shot. It's the, that complete safe resident is 14 days after the second shot. However, boosters is different. As soon as they get the booster, if somebody is fully vaccinated and they are in the hospital and you're about to admit them and you want them to be coming into the general population, ask the hospital to give that booster. That only applies to the booster, and you can bring them into the regular units. Sorry.
And let us know for sure that that answered your question, Dr. Gar. Thank you for being available for that. And I'm not seeing anything else in there, but please, by all means, we did see where the poll ended a little short for folks. So if you have additional comments you would like to add, please drop those in the chat now, and so that we can have those for consideration. And we will have the poll open longer next time, so that you all can have adequate time to answer everything. Maya, at this time, if we could go to the next slide. Again, we want to thank the University of Georgia and the Georgia Department of Public Health. Without them, we would not be here today. And we look so forward to our working relationship with them for the next few months or couple of years, I believe now, with all of the offerings that we're all going to be bringing to you. We're going to bring everything that we possibly can as far as updates. We have Dr. Gar as our medical director, Amy and Donald as our IP. So please, by all means, feel free to reach out to any of us in any three of our organizations. And next line. We at Alliant Health Solutions, thank you all so much today for joining us. We'd ask that you join us on not only our website, where the link has been dropped in for a couple of times now during this presentation, but we would love for you all to join us on our social media platforms. We are continually updating not only our website, but our platforms as well, and putting out information as much as we possibly can on Facebook, Twitter, LinkedIn, as well as YouTube videos. Dr. Gar alluded to a few minutes ago some of the bite-sized learnings that she is going to be making to give some information and just some quick snippets. We have those bite-sized learnings out there as well with our shop talks that we do monthly, and we will continue those with the NHSN support that we have tried to provide the very best and the very most updated information for nursing homes, and those are called Shop Talk Shorts. So please, by all means, go out, visit our website, and get all of the offerings that we have put together that you don't have to reinvent the wheel. We've put a lot of information out there around infection prevention for you. And we also want to say at this time, if there's something that's not out there that you would like to see that maybe we can produce, please let us know that. You can reach out to myself, Amy, Linda, Dr. Gar, Donald, any of us on our team, and let us know what you need. And there's a possibility that maybe if we don't have it, we can find it from somewhere else. And so again, I'm going to ask my panelists, do you have any parting thoughts before we close today?
Oh, I just wanted to make sure that everybody saw in the chat. Thank you, Amy, for pointing that out. Amy was like, CDC changed it to 10 days of quarantine. Again, I just want to apologize. It's not 14 days of quarantine. That's my old brain, but it's 10 days now. It is 10 days of quarantine for unvaccinated folks. So.
Yep, they snuck that one in there on us, and it is still 14 days after the second shot in your primary series before you're considered immune. So that has not changed.
Linda, Donald, any parting thoughts before we go, or anyone else that would like to pose a question very quickly or throw in chat box?
I was going to just say, you know, when we were thanking our partners, the good friends at GHCA got the message out for this meeting today, which was great because we were scrambling as fast as we could to get this done. And Perry Kemp from GMDA got a message out to the medical directors, and we couldn't do it without them. Jenny Nagley has been texting with me during this. I think we're all pleased that we're together in this, you know, kind of united front. If you could see my elbows in the air, we're joined together to really make this work well. And while it may be called strike fund teams that are financing this work, let me just say it's a support team that's there for the facilities that are caring for our seniors and those that are most vulnerable. And we're just so pleased to have this time together.
Thank you, Linda, and thank you, Amy and Donald and Dr. Gar for being available to answer questions. Again, we're here for you, and we want to make this time together successful once a month. So please let us hear from you for what we can offer, what we can bring as far as updates, or as Dr. Gar has done today, some clarifications, as well as we will be trying to bring any information that we get to guide you and bring you all of the information that we can to help you as you go along. We do thank you for everything that you have done over these past couple of years. We know that it has been difficult. We know that this journey has been long, and we hope that we are seeing the other side of it now where we can get back to our whatever our new normal is going to be. So to my panelists and for my panelists, we thank you so much for joining us, and we look forward to this next series in May. Dates will be coming out shortly, so when you see those, please go ahead and register, and we'll talk with you in May. Thank you so much for everyone.
Bye now.